Hello everyone, this is a public education video podcast. The topic is Alzheimer's dementia. My name is Dr. Sri Pratap Mohanamurthy. I am a consultant psychiatrist with 14 to 15 years of clinical work experience in psychiatry. As part of my role as a doctor, I am keen to educate the public about various mental health conditions and help people to improve their general mental health and well-being. I will be producing more videos on different mental health topics. These are not prepared for commercial purposes and should be used only for public education purpose. Please view them whenever you have the time. You may email me on drshripratap@gmail.com for comments, queries, and suggestions for improvement. The first topic that I'm going to discuss today is Alzheimer's dementia, and this podcast is the first part on this topic. Why am I talking about dementia? Dementia is a disease of older adults. Throughout the world, due to improvements in medical field, people are now living longer, which is good news. But this is also a risk factor for developing age-related disorders, and dementia is one among them. Before I proceed further, I'm going to give you a case example and I'm going to leave you to ponder. I will discuss the diagnosis at the end of this video podcast. Mr. P is a 78-year-old man brought to the clinic by his daughter. She reported that her father's memory is progressively getting worse over the last 1 year or so. His short-term memory is poor and he has difficulty remembering names of friends and family members. He is not remembering to pay his bills and needs help from his daughter with washing and ironing, etc. What do you think is his problem? We'll discuss the diagnosis in the end. Now, today's topics for discussion include what is dementia and what is Alzheimer's type of dementia? How common is this condition? How does it progress? And what are the symptoms and different stages of dementia? What is dementia? Dementia is a name given to a group of diseases that affect the normal working functions of the brain. Therefore, there is loss of brain function which occurs due to progressive destruction of brain cells. So the patient can present with a set of symptoms which includes memory loss, confusion, problems with communication, mood changes, and personality changes. Now, what is Alzheimer's dementia? Alzheimer's disease is one among them, and it is the commonest type of dementia. 60 to 70% of dementias are due to Alzheimer's disease. What happens in Alzheimer's disease? Everyone loses brain cells as they get older. But in people with Alzheimer's disease, this process is more severe and rapid than normal aging. This occurs due to destruction of brain cells. Why does this happen? Why do brain cells get destroyed so rapidly? This area is still under research, but there are problems identified both in the chemistry and structure of the brain. There are two important theories. One theory supports that people with Alzheimer's disease have shortage of some chemicals in the brain. This is called acetylcholine. This chemical is involved with the transmission of messages within the brain cells. When the level of this chemical goes down, The transmission of messages is affected. Therefore, people can present with memory loss and confusion. The second theory states that there are abnormal proteins that develop in the structure of the brain. These are bad proteins and they lead to further destruction and death of brain cells. Next question that people often ask me is, Doctor, is this progressive? Although the onset of this illness tends to be gradual, unfortunately, it's a progressive condition. The illness cannot be halted or reversed. The part of the brain that deals with memory is usually affected first. So patients become increasingly forgetful, and slowly other parts of the brain are also affected. In the later stages, people may develop problems with their speech or undertaking practical tasks. How common is this condition? Dementia affects 5% of people over the age of 65. However, the number of people developing dementia doubles every 5 years after the age of 65. So, say at the age of 80, 20 to 25% of people would have developed dementia. This is 1 in 4 or 1 in 5 of older adult population. Both males and females are affected. Although it mostly affects people over the age of 65, it can also occur in young people. Now let's look at the different stages of dementia and their presentation. The first stage is called as mild dementia or early stage. In the early stages, a person with dementia often appears confused and forgetful about things that have just happened. So the main problem is short-term memory loss, and they may not remember things that happened few minutes or few hours or few days earlier. But long-term memory tends to stay intact, and for this reason, people with dementia often dwell in the past. They may be forgetful of recent events. A couple of examples would be they may not remember what they had for breakfast this morning or what they had for dinner last night. They may not remember the content of the telephone conversation they had with people earlier in the day. People often misplace items at home, for example, glasses, reading glasses, wallets, walking stick, etc., and they keep searching for them. They often tend to forget appointments. It could be hospital appointments or other type of appointments. They often repeat themselves. They repeat conversations, and repetitive questioning is frequently observed. This can be quite frustrating for carers and family members who look after them. They are forgetful of people's names, known faces, etc. Now I'm going to talk more about other symptoms of mild dementia. People often get muddled about time, date, day, place, etc. Some may have difficulty in talking, or they may have word finding difficulties. They'll struggle to find the right word for the objects. Some people may have poor concentration. For example, they can watch TV for an hour, but when you ask them later what they had watched, they may not be able to give a lot of information about what they have watched. People may have difficulty in making decisions for themselves, and people may have difficulty in performing complex daily activities like cooking, shopping, paying their bills, washing, laundry, etc. Although I have described a number of symptoms in mild dementia, not all patients experience all these symptoms. They may present with a few of these symptoms, but I'm only giving you a general view of various presentations that can occur in mild dementia. Next stage is called as moderate dementia or middle stage of dementia. Here the dementia has now progressed, so they become more forgetful with poor short-term memory. They have increased difficulty with speech. They may have difficulty in performing even simple activities of daily living tasks. People may neglect personal hygiene. They may need prompting from others for washing, dressing, shaving, etc. Some can become restless at night time and sleep can become a problem. Some patients may also start wandering. They may wander inside the house, unable to find their way around familiar surroundings. They may wander around the streets at night time. This is really risky. Now, in people with moderate dementia, they may develop a lot of psychiatric symptoms and they come to see the psychiatrist for an assessment. Some of the common symptoms are anxiety and fearfulness. People can become extremely anxious because they know that the memory problems are getting worse and they can become very fearful. Mood changes are common. People can become upset with things very easily and they can also become depressed. Some patients can become aggressive. Initially, they may be verbally aggressive, but they can also become physically aggressive. They may see things or hear things that are not there. They often develop paranoid symptoms and accuse others of stealing them. Usually, they're forgetful, but they don't remember where they have placed. But because they can't find them, they accuse other people of stealing them. This can be really distressing for the family members and carers who look after them. Now I'm going to talk about presentation in someone with severe dementia. So in the later stages, people with dementia need a great deal of help. They're often not able to recognize family and friends, which is very difficult for family members and friends. They're unable to understand what is said to them, and communication is frequently a problem. They become highly dependent on others. Even simple things like dressing becomes really difficult. They may develop incontinence and have bowel and bladder problems. They may have walking difficulties and could become confined to a wheelchair or bed. Now, the stress upon carers is enormous as it becomes difficult to leave someone alone even for a few minutes. Now, we have come to the end of the presentation. Now, going back to Mr. P's presentation that I described earlier, after going through these slides, you may now acknowledge that they're probably displaying signs of early dementia. They may need further assessment and treatment from a psychiatrist. In the next episode, I'm going to talk about what causes dementia, how to diagnose dementia, what can be done to help, and different treatments that could be offered. Thank you for listening. For comments and queries, please email me on drshripratap@gmail.com.